My neurobehavioralist recommended I see an endocrinologist. I was perplexed by this recommendation. What does an endocrinologist have to do with traumatic brain injuries? Endocrinologists normally help people with hormonal imbalances, like diabetes and thyroid disorders. So I was wondering why I would need to see an endocrinologist for my fatigue. I was surprised to learn that researchers have been studying pituitary dysfunction caused by traumatic brain injuries. The pituitary is a pea-sized gland in the brain that can be damaged from a traumatic brain injury. It's right here. Researchers found that traumatic brain injury is one of the top reasons for decreased production by the pituitary gland. Decreased hormone production by the pituitary gland can cause symptoms such as fatigue, headaches, and dizziness. If you have neural fatigue, see a specialist like an endocrinologist. See one, though, that has experience in caring for patients with traumatic brain injuries. Neuroendocrinologists is another specialist that you can see. They help investigate how the nervous system and the endocrine system are interacting. These specialists can screen you for hormonal deficiencies by examining your MRI, reviewing your blood tests, and using procedures that induce and measure hormonal responses to stress. Two of the most common diagnoses are hypopituitarism and growth hormone deficiency. Hypopituitarism is when your pituitary gland doesn't make enough hormones to tell your other glands in your body to get to work. Growth hormone deficiency can cause you to gain weight at your waistline or make you feel depressed, anxious, or fatigued. Dr. Karaka and colleagues in their article, Growth Hormone and Pituitary Hormone Alterations After a Traumatic Brain Injury, found patients with traumatic brain injury-induced growth hormone deficiency have difficulty with cognitive abilities and mood control. They found when hormone deficiencies were treated, patients reported improvement in the quality of their life. After a blood test and a comprehensive exam and a glucagon stimulation test, my doctor explained to me that I had borderline neuroendocrine dysfunction with growth hormone insufficiency. He believed that this was the cause for my unrelenting fatigue. Since my diagnosis was borderline, I did not pursue treatment. Though receiving this diagnosis meant a lot to me, it reassured me that I was not a lazy ass and that there are multiple reasons for my fatigue. I also discovered that I didn't need to exercise more or sleep less. Fatigue can be caused by multiple medical conditions, some of which can be treated. Therefore, it's important to follow up with your healthcare provider and let them know of your fatigue so these other conditions can be ruled out. Otherwise, your general practitioner can also refer you to these specialists. I wish that soon you'll feel better, and take care.